How do doctors measure TB skin test results in? Imagine getting a TB skin test and wondering exactly how doctors decide if it's positive or not. Well, it all comes down to measuring a small, raised bump on your arm. After the test, which involves injecting a tiny amount of purified protein derivative into your skin, the doctor waits about 2 to 3 days. When you return, they look for a firm, raised area called an induration at the injection site. This induration is what they measure in millimeters using a ruler. They focus only on the hard, swollen part, not the redness or any swelling around it. To measure, the healthcare provider places the ruler across the bump, perpendicular to the arm's length, and notes the longest diameter. If the bump measures 1 millimeter, that's recorded as 1 millimeter, even if it's between two marks. The size of this induration helps determine if the test is positive, based on your risk factors. For example, if you have a high risk like HIV infection or recent contact with someone with active tuberculosis, a bump of 5 millimeters or more is considered positive. For moderate risk groups, such as healthcare workers or recent immigrants from high prevalence areas, 10 millimeters or more indicates a positive result. If you have no known risk factors, a bump of 15 millimeters or more is needed to be considered positive. This precise measurement process helps doctors decide if further testing or treatment is necessary. Remember, only the size of the induration is measured, not redness, and the interpretation depends on your personal risk factors. Always consult your healthcare provider for personalized advice and follow-up.